Dr. Anthony Collada, I'm a board certified psychiatrist. Now in this video, I'm going to talk to you about the different neurotransmitter types that we often prescribe medications for to treat clinical depression. And of course, as a psychiatrist, my first go-to is medications, but there are so many other approaches to help with clinical depression besides medications. But first, I'll talk about the different neurotransmitter systems like serotonin, norepinephrine, and dopamine neurotransmitter systems. And then at the end of the video, I'll talk about other approaches besides medications that can make actual changes in our brains to heal or to help with clinical depression. Now, a lot of people are familiar with selective serotonin reuptake inhibitors or SSRIs, and those all work on serotonin. And so oftentimes as a psychiatrist or medical professional, we're going to prescribe an SSRI to try to help treat clinical symptoms of depression. Unfortunately, the data is not that promising with how effective SSRIs are in treating depression. It's estimated that maybe 1 out of every 7 people who start an SSRI will actually find help or healing from the medication. There's also SNRIs, which deal with serotonin and norepinephrine. Now, serotonin is basically a molecule that helps to keep the brain and body calm, while norepinephrine is more like the adrenaline hormone or noradrenaline. So it's like that fight or flight response will often secrete that noradrenaline. So somehow along the way, there's a dysregulation of these hormones in clinical depression. At least that's the leading theory. And so these medications help to restore the imbalance in the body. Now, one way to conceptualize this is like if there's too much stress or too little stress, the homeostatic or that equilibrium that the body wants goes out of whack. So you want just a little bit of stress in your life or enough stress to help you to be motivated, to get things done, to function, but not too much stress to where you can't function, and not too little stress to where you don't get up and do things and so forth. You could try an SSRI to help with clinical depression. SSRIs like escitalopram, fluoxetine, citalopram, there's several in the class. And then you can try SNRIs. Ones that are commonly prescribed in the United States include duloxetine or Effexor. And then you can get into other antidepressants that work a little bit differently. So there's the other molecule called dopamine that's thought to play a role. And so an antidepressant that works on dopamine is Wellbutrin, also known as Bupropion. And this can also help with ADD or ADHD-like symptoms, but it can be an antidepressant that helps people, especially in cases of seasonal depression. For example, if they get depression in the fall or winter months, because this medication can be a little more activating, more energizing, and can help people to focus a little bit better and get tasks done. So sometimes if you're on an SSRI or SNRI and you don't find effect or you don't feel like it's enough to help alleviate the depression, then the doctor can add something like Wellbutrin on top of that, because then that will help cover all the 3 neurotransmitter types, the serotonin, norepinephrine, and dopamine. Now, why we think all these 3 neurotransmitters are implicated? Well, several years ago, there's a very effective medication class called the MAO inhibitors that basically increase all of these neurotransmitters in the brain and body. But the MAO inhibitors aren't really prescribed often nowadays because of its extensive possible side effects. It's just not worth it. And so you can use the more modern medications, which are a little bit more subtle, may not have as strong side effects, but can still target all these 3 neurotransmitter systems. Other medications that can be helpful for depression include mirtazapine. Now, mirtazapine, we're not sure exactly how it works. Mirtazapine is thought to help with some of the serotonin receptor system, but also other receptor systems. So we're not sure exactly how it works, but it could be a good option if someone is having trouble sleeping at night or if they're having a poor appetite or low appetite, because this medication can be sedating, so it can help people sleep and it can increase appetite. So all these different medication types can definitely change the brain's response to the neurotransmitters to help alleviate depression. But there are several other ways to help alleviate depression. We find even cognitive behavioral therapy can actually make changes in the brain so that it helps rewire how people are thinking, and that's in itself can help heal depression. And so you can imagine also how much living an active lifestyle, exercising, eating healthy, getting adequate sleep, having a good social network or social support, all those can play an important role in depression. One's relationships and how they interact with others or how people are treating them can play an important role. There's just so many factors involved, which is why it's important to have a thorough evaluation by your medical professional or mental health professional in the process of getting treatment for depression. There's also several medical problems that can lead to depression, like low thyroid. Maybe someone is dealing with a lot of physical pain or medical illnesses, and that can affect one's moods and thoughts. So sometimes just the perfect combination of medications is not going to resolve the depression if there's underlying factors that need to be improved first that helps with the depression process.